more detail about the announcements today. Catherine.
Thank you, First Minister. We've said now repeatedly from this platform that we're on the cusp of the rapid acceleration of cases of coronavirus within Scotland. Sadly, we've also talked about people dying and people being seriously unwell and admitted to intensive care. Those 14 deaths probably each represent up to 1,000 people that have become infected. We have 23 people currently in our ICUs across Scotland who have coronavirus, and each of them represents perhaps 400 to 500 other people that will have become infected in the course of their illness. But we also know that our community surveillance is going to increasingly give us an accurate picture. And I would predict that, as we've said repeatedly, those numbers are an underestimate of the actual size of the issue within Scotland. The measures we've talked about are hard and life-changing. The people that you interact with, if they give you coronavirus, you will pass that on to the members of your household. You're risking actually infecting the people you spend most time with, the people you love, your friends, your family, your elderly relatives. So when people are mixing outside their families, they really need to be absolutely sure that those interactions are worth the risks that they are taking. We've talked repeatedly about risks to our NHS, but people who are not socially distancing, who are not following the measures, are not only risking themselves, their friends and families, they're also risking the health of our NHS staff. NHS staff, social care staff, who perhaps more than ever before need to be protected in order to keep as many people alive in this pandemic as possible. We know that this is difficult, and we know that this is for the long haul. We have said these measures are at least 3 months in the first instance. So we need to be realistic about people's lives. So exercise, extremely important, fresh air, keeping fit, but also it's very good for people's mental well-being. So we're saying that people should go out once a day to exercise, whatever that exercise may be for you, a walk, a run, a cycle, but don't do it except in small family groups. Do not mingle with other people while out in the outdoors. We're going to have to adapt to life in this new world. We don't want people to become unwell for other reasons. We want to keep people as fit and healthy as possible. So we'll encourage people to continue to use the outdoors, to keep their mental and physical well-being as good as possible. But we're really in this for a marathon, not a sprint.
Thank you, Catherine. I'll hand over now to the Cabinet Secretary.
Thanks very much. So the new National Community Hub and Assessment Centre service that we have started today is for patients experiencing COVID-19 symptoms who require additional clinical and medical advice and support. It rests on that 111 phone number, and that is why it is very important that people currently using that number to access sick notes go instead to the website. When individuals phone the 111 number for that additional medical and clinical advice and support, they will be asked a number of questions, and on the basis of their answers, either provided with additional medical and clinical advice or an appointment made for them to attend the local assessment centre. At that assessment centre, they will be seen in person and again either provided with treatment at that point or admitted to hospital. So this is a single service across the whole country, delivered through our health boards, covering our remote and rural communities as well. So it is national coverage through that 111 phone number available 24/7. What that also allows us to do is to free up our GP practices to continue to provide the healthcare that they do provide to non-COVID-19 patients. And bringing in the community pharmacy, extending their reach through the minor ailment service and their access to emergency care records, which contain by and large information about the medication that a particular individual is on, allows our community pharmacy service, again across the whole country, to play its full part in responding not only to the COVID-19 challenge, but to provide healthcare services to patients appropriate to the community pharmacy. All of that is designed to ensure that individuals have a single route to the advice and support they need to help them if their symptoms require it, and at the same time ensure that our health service in the communities, the bedrock of our health service, continues to provide the health care that other patients need who do not have COVID-19 symptoms.
Okay, thanks, Jean. I'll take some questions now. Mark.
On your point about people getting the message, some of your MPs and MSPs have been putting out messages that haven't been great. You've got John Mason, take risks, trust in Jesus, go to church, come to my constituency. You had Karen Monaghan today saying, why aren't we testing people at airports when the Chief Medical Officer has already said that's not effective. You had Richard Lyle last week saying unconfirmed rumours about the army gathering in public parks. Today we've also got ScotRail, which is a government franchise holder, saying that there's nothing they can do to stop people packing into trains. They say people should take personal responsibility, we can't stop them. What would you say to all of that? Okay, well,
I'll try and... I appreciate these are all connected, but there's differences between these examples as well, so I'll try and take each of them on. I haven't seen Karen Monaghan's tweet this morning, but I know what you're referring to with Richard Lyle. People are entitled to ask questions, and actually I think if people have questions, I'd rather they were asking them on behalf of constituents or as individual citizens, so we can answer those questions. And if there is misinformation out there, such as the army in Strathclyde Park, we can put that right. So I don't want people to feel that they can't ask questions. In terms of ScotRail, I've got sympathy with what ScotRail said there, which is why I said I think there is a responsibility on the government to make clear to businesses that there are too many people right now who are still being expected to go to work. And that's why I'm being very clear today that businesses have a responsibility to really look at what is essential and what is not. And if it's not essential, or if their workers can't work at home or they can't practice safe social distancing, then they should consider closing or hibernating the business at this period and accessing the support that is available. I recognise that different businesses will find these judgments difficult to make, which is why we're going to do a bit more guidance to help people work their way through these judgments. There will always be difficult cases, there will always be exceptions, but I'd rather we work through the exceptions from a point of principle that we must be supporting people to stay at home as the key piece of advice wherever possible. On John Mason, I would say very categorically the advice he has given around his constituency office and going to church is not the right advice. And I think it is important that all of us, particularly elected representatives, give people the right advice. Unfortunately, I've got huge respect for people's faith, and I'm not criticising that in any way, but you are at risk if you're surrounded by people in a church, just as you're at risk if you're surrounded by people in another crowded place. All MSPs and MPs, in my opinion, should be making arrangements to close their constituency office, not to close the services they provide, but to do that in a different way. If we are asking businesses across the economy to make these changes, we must be prepared to lead by example and make those changes ourselves.
If I've got a clarification on ScotRail, do you accept ScotRail's explanation then that there's nothing they can do to limit the people getting on the trains if people don't...
I'm not trying to dodge this, but I've not seen the specific comments that ScotRail have made, so it's probably better I look at them in the context, and if there is a need for us to give some more guidance or have a discussion with ScotRail, we will do that. I want everybody to be doing the right things just now, but if I'm being asked, and this is not your fault for being asked about something I've not seen, I would rather, in the climate we're in just now, when clarity and accuracy of information is important, I'd rather check that out and then come back to you later if I've got a view on the need to do something more. Peter.
First Minister, the ENS and Dumfries and Galloway have written to the Council because they say there's confusion over when schools should be open for key workers. The head of the National Farmers Union, Andy McCormick, has said leaving decisions on key workers to councils is, and I quote, haphazard. Do you not think you might now have to give more rigid guidelines from here as to who are key workers?
Well, I'll say the same to you as I've just said to Mark. I've not seen those comments, so I would want to see them and consider them in full. But let me try and answer the question. In general terms, we have set out as government the key categories of people that should be, and the order of priority around key workers. I've always said, and I still think this is the case, that what is essential in a rural area will not be identical to what is essential in the centre of a city, and we have to have a degree of flexibility, both in how services are being provided and also who those services might be provided for. But that variation should not be wide variation. So we will continue to work closely with councils, with COSLA, and if there is a need to bring more consistency to that, we will not hesitate in doing that. The key workers issue has been one of the most difficult, I'll be candid about this, to work through over the last few days, because understandably, all businesses, all sectors want their workers to be considered to be key, and the fact that they're not doesn't mean they're not important. But I come back to the central point of why we close schools, because the experts, people like Catherine, advising government that not having children congregating in large groups in schools helps us with the central objective of slowing the spread and reducing the impact of coronavirus. So if we simply go to an arrangement where we've got large numbers gathering for care of key workers or whatever, then we undermine that health objective. So it's really difficult stuff, this, but it's important that we do this in an orderly way. That's what we're seeking to do. But as with everything right now, we'll monitor all of this carefully. And as I've just said with businesses, if we feel that there's a need for greater central guidance to help people navigate difficult situations, then we will absolutely step in and do that. Lisa, yeah.
Can I ask about just the kind of, again, the rapid acceleration of cases? I mean, you talk about 23 patients in intensive care today and the need to then increase capacity in our NHS. Are we still significantly behind other parts of the UK in terms of that acceleration? And are we seeing spikes already in our key cities, perhaps? And, you know, how prepared are we for that to inevitably happen?
We're certainly significantly behind London and the southeast of England, absolutely, definitely. They have had these sort of numbers of cases many weeks ago. The publication of the health board areas would show you that Greater Glasgow and Clyde has had the most cases, 130 there today, and then a widespread across our other health boards. I wouldn't be prepared to discuss in any detail where these intensive care cases are, and remember that they will be in different units even within the one city or the one health board. So we are looking very carefully at our the geographical spread. We're not seeing that one particular geographical area is a cluster, as you might have become familiar with. What we are going to do from later this week is ask for the genotyping of all of the coronavirus patients in intensive care, which will allow us to give that further accuracy to whether there is one type of the coronavirus in lots of those people. So have they caught it from each other? Or is it that there are multiple sources of coronavirus from different parts of not only the country, but parts of the world? So that will give us further geographical accuracy in the coming days.
Okay. Yes.
How close are we to lockdown, given the kind of flagrant ignorance of the advice and the guidance that was issued on Friday evening?
I wouldn't use the term flagrant. Over the weekend, the vast majority of pubs, clubs, restaurants followed the advice and closed. There was a small number who didn't, and the police were able to take action to issue closure notices under licensing law yesterday. We will, within a matter of days, have the new powers under the emergency legislation, and will not hesitate to use those. The vast majority of people are doing their best to comply here, and I want to encourage people to really think hard about their behaviour and make sure that they're doing the right things. And that's why I keep saying this. Ask yourself how normal your life feels right now. And if it feels completely normal or close to normal, then you're not doing the right things, and you should really look at that. Let me try to take this lockdown. I've always said, you know, if I cast my mind back to this time last week standing here, I was still telling you why it wasn't the right time to close schools. A couple of days later, I was telling you we were closing schools. This is a fast-moving situation. We're trying to take decisions based on the best advice so that we're doing the right things at the right time. So it is very possible that in the days to come, we will see more stringent measures being applied. But if you kind of take a step back from the word lockdown and think about what all the components of that would be, asking people to stay at home and not go to work unless it is vitally essential, asking people not to go shopping unless it's for food and medicine, asking people to keep their distance, not gather in crowds of people. That's essentially the elements of what you're seeing in other countries where it's been described as lockdown. I guess the The missing bit that we may have to move to, if the advice tells us it's necessary, is whether that is being issued in the way of advice, although I'm being very clear, we want people to treat it as rules, or whether there is more enforcement on that. And I can't rule that out. And what I would say, as First Minister, I will not hesitate to do what is necessary here. I think if you told me, even just a matter of weeks ago, that I would have, in the course of 7 days, stood and advised the closure of schools, pubs, restaurants, and today shops, I would have struggled to believe you. We have to do the right thing to help reduce the spread. So I'm not ruling anything out. But what I also want to be crystal clear on is that the public don't have to wait for lockdowns or enforcement to do the right things. It's within the ability of each and every one of us as citizens, as people who all have loved ones, people we care about, people we don't want to see get ill, and all of us, like myself, my sister this morning was in a ward in the NHS, people working in the front line of our NHS, we've all got it within our own ability to do the right things now. Don't wait for somebody to tell you in some more enforceable way that you have to do it. We're telling you what to do now. Please do it.
But just to follow up on that, we saw parks and with the good weather, everyone out. Are we not making the same mistakes potentially as Italy with not shutting down essentially sooner?
We're shutting down pubs, clubs today, asking non-essential retail outlets to shut. I very clearly yesterday, and called a press briefing to make to give these messages very clearly. I understand human instinct. I have it. I understand that people think because you're outdoors, the risks from this virus are not the same. But if you are in crowded places, whether it's indoors or outdoors, then you're encountering the same risks. So, as the Chief Medical Officer has rightly said, we don't want the impact of what we're doing here to lead to other health problems, mental health problems, isolation and such like. So people have to get out and get some fresh air and exercise, but we've been very clear to people how they should do that on your own or with one or two other people within your own family group. As much of your contact right now, and I know this will make lots of people tear their hair out, but as much of your social contact right now has to be within your own family group. And that applies to outdoor exercise just as it does to indoor activities. So it's not possible for me to be clearer than this. Of course, if people don't comply with this, then yes, we have to look at how we enforce it more. But let's all try to do the right thing now. It's for the good of all of us. I keep saying we are all in this together. All of our lives are changing right now, but we know why it's important. So let's just go on and do the right things. Yes.
First Minister, yesterday you told us that there would be 200,000 people in the high-risk category receiving a letter about strict advice. That was the same message on the 16th of March this year, the same briefing. So why has it taken so long to get that message out, and when will they receive the letters?
Well, as you probably recall, on the 16th of March, we said that wouldn't be happening immediately. There was work going on. Firstly, I'm going to hand over to the Chief Medical Officer in a moment. She and her colleagues across the UK have been looking very carefully at what the conditions are that we need to give this extra rigorous advice around isolation would be, and we've been putting in place and are putting in place the plans to properly support them. So those letters will start going out over the course of the next few days. People within this group, by and large, will know that they're in a group like this, but getting the support arrangements in place is vital, and that's what we have been working on. But can you maybe say a bit about the process that you and your colleagues have been undergoing to get to this?
If we look at before coronavirus, people who were having, for example, current chemotherapy treatment for cancer, they're already told advice about staying away from others, about limiting their risks of exposure to any sort of infection. The reason that we've been very clear to risk stratify who would be in these very much more vulnerable groups is because we're asking people to self-isolate, to have virtually no contact with anyone else at all for 3 months. We didn't want people to be thinking they were in that category if actually their risk was not as significant as that. So we have looked at a very long list of potential categories where people's immune system is suppressed, either that because of treatment that we're giving, because of drugs that they're on, or because of the inherent nature of the disease. And we've taken our time to go through the specialist societies of the clinicians who look after those people to really be clear that we're not giving advice that is either too lenient which risks people's lives, but also not putting people in these very restrictive categories, and really very restrictive, and will have other implications for their mental health and well-being. We didn't want to do that if it wasn't actually necessary. So we've worked that through. Our list across the UK is the same. Our methods of contacting people are slightly different because of the way our health services differ across the UK. But the people who've been, if your implication is waiting since the 16th of March to be told, that people in the very highest risk groups had already been given that advice because of the treatment that they were on, not related to coronavirus, but related to infection risk generally.
Yes.
Can you provide any more information on the community hubs that you're going to set up? You know, where are these going to be? What kind of buildings are they going to be in? And how many are there going to be across the country?
So the community hub is a virtual hub. It's a phone, so you get to it through 111, and at that point you're transferred over to the hub where you will get that clinical advice that's available now in every single health board across Scotland, and some, for example, are taking calls and covering our island communities. The assessment centres will be available in every health board area, including the island ones, and they are in all of those except 2 at the moment. Those 2 will be available by the end of this week, and we will increase the numbers where we see the need in terms of cases increases the demand. At this point, we will later on today make it clear where these assessment centres are once we've absolutely finalised the details, but those assessment centres are physical places because people will, if it's assessed that they need to, an appointment will be made for them to go there and have that face-to-face treatment or be transferred into hospital.
Okay, and yes.
You talked about businesses that would struggle to operate with social distancing in practice. What about supermarkets? How easy it is for people on checkouts and people stacking shelves to not touch things that other people are touching? And is there any thought being given to the Army getting involved in food distribution the way they've talked about at Westminster?
Well, the Army may well have roles to play around making sure that we keep essential supplies, but we don't want to be reliant, nobody wants to be overly reliant on the Army, who have limited resources as well. We can't close supermarkets. We need to keep food supplies accessible for people. I would repeat my exhortation to people not to panic buy and stockpile, because that's what causes shortages of things. But we are encouraging supermarkets or pharmacies where people have to go for essential medicines to put in place procedures that keep people distanced. I've seen some on social media, good examples of shops doing that. I've also seen some examples of shops not doing that properly. So again, this is an area where we will be happy to offer advice and guidance to shops, but I would come back to my central point. You should be at home if you can be. If you're not at home because you have to be out for some essential purpose, then keep that 2 metre distance rule firmly in mind. And yes.
Can I ask where we are with ventilators? I know that obviously you were ordering more. Just wondered if we're any closer to having more being installed in hospitals.
So you know that the intention is, the work is underway to double our ICU capacity, and what we're then looking to do is increase the number of ventilators beyond that doubling of ICU capacity. We're doing that in a number of ways. Part of the UK-wide work involves us to source additional ventilators, and we are also pursuing our own routes on top of that. So we've got a lot of work underway to secure additional ventilators, more than we need simply by doubling ICU capacity. That involves the delivery timelines, constant contact with the sources where we've placed orders to try and make sure that we can speed up as far as we can those delivery timelines, and that the delivery timelines we're given are actually met, as well as the UK-wide work that we're engaged with.
It's an ongoing. We'll put more information out there. I don't want to, again, I'm not putting information out there that is moving almost as we speak here, so we'll make sure that that information is given properly. But as Jean said, I think there's a couple of points worth stressing. The doubling of ICU capacity does not depend on more ventilators. That is to increase capacity more than that. And we have orders in of our own. We're working in the UK context. The other thing I was going to mention is Ivan McKee, one of our business ministers, is chairing a manufacturing group to look at how we can potentially repurpose some manufacturing capacity towards the supplies of medical equipment that are required. Right, any final questions? If not, can I thank you all for coming, and we will see you on the next occasion, probably tomorrow, unless there are developments today that require us to come back earlier. Thank you all.